Hi, my name is Alexis Hall, and for my applied ethics presentation, I'm going to be talking about euthanasia. Is ending suffering an act of mercy? Many people hope their final moments will be peaceful, yet the reality of suffering often complicates that hope. This is where the debate over euthanasia becomes deeply emotional and morally complicated. Should someone have the right to end their pain when medicine can no longer offer comfort or dignity? Some see euthanasia as an act of compassion, while others fear it crosses a line that society should never step over. The tension between preserving life and relieving suffering makes this issue far more than a legal question. It becomes a reflection of what we believe about autonomy, care, and the value of human life. Euthanasia forces us to consider whether respecting a person's final choice is an act of mercy or an ethical mistake. Can ending suffering ever be the right choice? Imagine facing a future where every day brings unbearable pain and the promise of relief seems impossible. Should someone have the right to choose a peaceful end rather than endure endless suffering? The debate over euthanasia forces us to confront difficult questions about compassion, dignity, and the value of life itself. Some argue that choosing death is an act of mercy, while others fear it undermines society's respect for life. This ethical dilemma is not just theoretical, it affects real people and families struggling with impossible decisions. By examining euthanasia through the lens of moral philosophy, we are challenged to consider what it truly means to act in the best interest of those who suffer. Can ending life ever be the most humane choice? What would a utilitarian think about euthanasia? Let's find out. Thesis. A utilitarian approach supports euthanasia because it prioritizes reducing suffering, increasing overall well-being, and allowing individuals to choose the option that results in the greatest balance of relief over harm for everyone affected. Supporting Argument 1. Euthanasia can reduce or eliminate intense suffering, improving one's overall well-being. A core utilitarian value is minimizing suffering and maximizing well-being. For someone terminally ill, patients' continued life may means prolonged pain, loss of dignity, or severe decline in quality of life. Allowing euthanasia can end unbearable suffering and thereby increase overall welfare for the patient and often for the loved ones. As argued in the paper Euthanasia and the Good Life, while euthanasia is sometimes ethical, from a hedonistic consequentialist perspective, when the pain and suffering of prolonged life outweigh the benefits, aka death, euthanasia may be morally acceptable. If euthanasia is chosen voluntarily and rationally, then assisting someone in ending unbearable suffering can be seen as a compassionate act that maximizes net welfare, aligning with the utilitarian principle of promoting the greater good. Supporting Argument 2. There is no morally relevant difference between active euthanasia and passive euthanasia. In many cases, active euthanasia is more humane. Some argue that letting someone die is morally acceptable, but actively killing is wrong. Utilitarians like James Rachel challenge that distinction. The end, death, and the relief of suffering are the same. But active euthanasia often ends suffering quicker and more humanely than passive waiting, which might prolong pain. Rachel argues that if passive euthanasia causes prolonged suffering, then in those cases, active euthanasia might not only be permissible but morally preferable because it reduces the total amount of suffering and leads to better overall consequences. From a utilitarian consequentialist view, what matters morally is the outcome, minimize suffering and maximize welfare, not the method, so active euthanasia can be justified when it lowers suffering most effectively. Supporting Argument 3. Respecting autonomous rational requests for euthanasia promotes individual welfare and autonomy, aligning with utilitarian preference satisfaction. Some utilitarians, like Peter Singer, argue from preference utilitarian standpoint, individuals have their own preferences about living or dying, and if the rational and competent person prefers death over continued suffering, then enabling that preference is morally justifiable. In his essay, Voluntary Euthanasia, a Utilitarian Perspective, Singer argues that when someone's future quality of life is hopeless and continuing life would result in overwhelming suffering or loss of dignity, assisting them in ending their life respects their autonomy and promotes welfare, resulting in a better balance of well-being versus harm. By recognizing and honoring a competent individual's rational desire for euthanasia under extreme suffering, Utilitarian ethics acknowledges the quality of life and personal preferences matter, not just mere biological life, thereby aligning moral judgment with well-being, autonomy, and maximize suffering. Why these arguments fit a utilitarian ethical framework? 1. Minimizing pain and maximizing well-being. Utilitarianism evaluates morally based on outcomes, specifically how actions affect overall happiness or suffering. Euthanasia can directly address this by ending extreme suffering when there is no more hope for recovery. By reducing unbearable pain for the patient, it increases net welfare. Families and caregivers also benefit emotionally by witnessing a peaceful death instead of a prolonged suffering, which adds to the total happiness in the scenario. In this way, euthanasia aligns perfectly with the utilitarian goal of maximizing well-being and minimizing harm. Number 2, choosing the action that produces better consequences. Utilitarianism judges act by their consequences rather than strict rules or intentions. In the case of active versus passive euthanasia, the outcome matters most. Ending suffering sooner is better than prolonging it unnecessarily. Active euthanasia can produce a more peaceful and dignified death, which increases overall well-being compared to waiting for natural death that might involve additional pain. This focus on results, like choosing the action that brings the best net outcome, and mirrors utilitarian reasoning. Number 3, the rational preferences enhances welfare. Preference utilitarianism emphasizes fulfilling the desires of rational individuals, as their preferences often correlate with their well-being. If a competent patient chooses euthanasia to avoid suffering, honoring that choice satisfies their preferences, reduces pain, and respects their autonomy. Ignoring their informed decision could lead to increased distress and decreased welfare. Not just for the patient, but for their loved ones. By respecting rational preferences, utilitarianism ensures that the moral decisions enhance total happiness and minimize suffering, showing why euthanasia can fit within this ethical framework. Okay, this is just a continue. But utilitarianism, especially act utilitarianism or preference utilitarianism, judges actions based on their consequences, the overall balance of happiness, suffering, and preferences fulfilled or frustrated. Not by whether an action is inherently killing or letting die. In case of terminal illness with no hope of recovery, the continuation of life may bring little or negative net welfare. Euthanasia may be the action that results in the greatest net good, less suffering, more dignity, and relief. Recognizing that sometimes life biologically may no longer contribute to welfare if suffering is extreme, utilitarianism remains flexible and sensitive to context rather than rigidly opposed to death per se. In summary, a utilitarian approach to euthanasia ultimately focuses on choosing the option that produces the greatest overall well-being and the least amount of suffering. Since utilitarianism evaluates morally by consequences rather than rigid rules, the central question becomes whether euthanasia leads to better outcomes for everyone involved. In many cases of terminal illness, continued life brings severe, unavoidable pain, so ending that suffering can create a better balance of relief over harm. The argument that active euthanasia may be more humane than passive methods also fits this framework because utilitarians prioritize actions that minimize unnecessary pain and lead to the best possible results. Respecting a competent patient's rational choice further reinforces the utilitarian view, since honoring personal preferences often increases total welfare and prevents emotional distress. Together, these points support the idea that euthanasia can be an ethically sound option when it reduces suffering, fulfills meaningful personal wishes, and improves overall well-being. From a utilitarian standpoint, the compassionate choice is the one that brings the greatest net good, even when the choice involves difficult decisions at the end of life. Possible counter-argument would basically, in summary, this would just argue that euthanasia is not morally or ethically a good choice. I feel like I'm running out of time, so I have to summarize that. And then also a summary on my personal opinion. Basically, I chose this argument with euthanasia and a utilitarian perspective because it's the one that I would believe in for this. So I would agree that euthanasia should be allowed when someone is at the end of life and they want to end their suffering. And so what would you choose to do? If you had the opportunity, would you choose to enforce the will for someone to pick euthanasia, or would you rather someone suffer? The ethical choice is yours. And these are my sources, and that's